Bismillahirrahmanirrahim. My name is Dr. Sahar, and today I am going to tell you about the radial nerve, its whole course in the arm, in the forearm, and along with its injuries. I'm just repeating the radial nerve course in arm so you have a better view of this nerve in whole of the posterior compartment of arm as well as in the forearm. So let's discuss about that. Radial nerve in the arm is mainly whenever we are going to start any type of a nerve, we should know where it originates or from which it is rising and from where it is coming. So the radial nerve is arises from the posterior cord of the brachial plexus and its root value is C5 to C8. It is very important branch that is supplying whole of the muscles of the posterior compartment of arm as well as forearm. It is the largest branch of the brachial plexus because it's coming from the posterior cord. So the radial nerve, once we came to know from where it is originating, we should know about its course. So the radial nerve is given of the is coming from the posterior cord and runs behind the third part of the axillary artery, and it leaves the brachial artery and enters the lower triangular space. Here in this picture you can see that the radial nerve, this one is the radial one, okay. So this radial nerve is coming from the lower triangular space. It leaves that, and once it enters into the arm, it lies posterior to brachial artery, medial to humerus, and anterior to the long head of tricep brachii. Okay, it is just anterior to the long head of tricep brachii. Here you can see this is the long head of tricep brachii. इसको पीछे किया हुआ, ठीक है. Mainly this is anterior to long head of tricep. Then it moves, you can see, infralaterally and reaches to the lateral side of the humerus. It enters the radial groove. Okay, then it moves from the radial groove and reaches to the lateral border of humerus, and just 5 cm below the delta tuberosity, it pierces the lateral intermuscular septums to enter the anterior compartment of the arm. Okay, it pierces the lateral intermuscular septums and enters to the anterior compartment arm, and here it reaches to the lateral epicondyle of the humerus. The radial nerve basically terminate by dividing into superficial and deep branches just below the level of the lateral epicondyle. Okay, or once it enters into the cubital fossa, the course of the radial nerve in arm is completed, and here it just divides into 2 branches, which we will discuss later on. So at this level, you know in the arm its origin, its course, and its relation. Now we are going towards its branches in the arm. The branches of the radial nerve in the arm is divided into three main categories. In the axilla, it gives branches. In the radial groove, it gives branches, and before the radial groove as well. So in the axilla, the radial nerve gives off branches, that is the muscular and cutaneous. The muscular are the long and medial head of the tricep brachii. Here it gives the branches to the long head of tricep brachii as well as the medial head of the tricep brachii. ये कटा हुआ जो आपको नजर आ रहा है, this is the medial head. Okay, and along with that, the posterior cutaneous nerve of the arm is also originating in the axilla. Now the branches that are coming in the spiral groove. Okay, in the spiral groove, the muscular branches that are given by the radial nerve is the lateral head of tricep brachii, and some branches are also given to the medial head of tricep along with the anconeus. And in the spiral groove, it also gives cutaneous branches, that is the lower lateral cutaneous nerve of the arm and the posterior cutaneous nerve of the forearm. This posterior cutaneous nerve of the forearm is very important, and it arises from the radial nerve in the posterior compartment of the arm, and it runs along the radial groove of the humerus, and it reaches to the subcutaneous tissue of the posterior it reaches to the forearm independent of the radial nerve, descending in the subcutaneous tissue of the posterior aspect of the forearm to the wrist, and it supplies the skin of the wrist. Okay, so this was the posterior cutaneous nerve of the forearm, which gives cutaneous supply to the arm and the forearm. It's basically moved towards the forearm. So once it reaches this, the radial nerve reaches to the lateral epicondyle, or just below the radial groove. It gives branches to the brachioradialis, extensor carpi radialis longus, brachialis muscle as well, and it also gives some articular branches to the elbow joint. This was the whole branches in the spiral groove and the below the spiral groove. Now, what happened whenever there is an injury to the radial nerve? The injury to the radial nerve in arm is mainly occur in three different areas. It may occur in the axilla. It may occur in the fractures of the shaft of the humerus. So, in axilla, most commonly the injury is occur because of the pressure of the crutches, or because of the sleeping of a person in an armchair with the limb hanging on the side of the chair. So at this causes there is a pressure on the axilla, and it causes the damage to the radial nerve. So whenever there is a damage of the axilla, damage to the radial nerve in the axilla, it will causes the loss of all of the muscles of the posterior compartment of the arm or forearm, because all of these muscles are supplied by the radial nerve. So there will be characteristic sign which you can say, that is wrist drop. Why? When the nerve is injured in the before injury to the radial nerve superior to the origin of its branches, okay, and I have told you that it is given the branches to the tricep muscle, brachioradialis, supinator. These are all the muscles that are coming just after the axilla. So all of this supply, because of this, there is a complete loss of or complete paralysis of all of these muscles, that including the tricep, brachioradialis, supinator, extensor muscles of the wrist and fingers. And there will be a characteristic sign, clinical sign of the radial nerve injury, which is termed as wrist drop. What is wrist drop? Wrist drop is the inability to extend the wrist and the fingers at the metacarpophalangeal joints. Here you can see the person cannot extend his hand. Here he is unable to extend the fingers at the metacarpophalangeal joints. These are the metacarpophalangeal joints. He is unable to extend that. Here you can see the person is unable to extend the wrist and fingers, and this is termed as wrist drop. Now, what happened when the injuries occur just before the radial groove? So when the nerve is injured just before the radial groove, so all of the supply of this these muscles, the tricep brachii muscle is occur. So the lateral head and medial head and long head, they all are affected, and there will be loss of all of these muscles. But once the nerve is injured in the radial groove, the tricep is usually not completely paralyzed. Why? But only it is weakened, because there I have told you already that the branches to the medial head and the long head are given at this point. So the not only the medial head is paralyzed, also the lateral head is paralyzed, because in the radial groove the branches are given to these heads. So both of them are paralyzed at this point. Okay, we remember this thing, that before the radial groove, all of the hands of the heads of the triceps are lost. But in the radial groove, whenever the injuries occur, there is not complete paralysis of the tricep. Only the medial head and the lateral head are affected, because their branches are coming at this point. This was the injuries to the radial nerve in arm. Now the course of the radial nerve in forearm. Similarly, we will start the course in the forearm like that. The radial nerve once reaches to the lateral side of the lateral epicondyle of the humerus, and then enters into the cubital fossa. Anterior to the lateral epicondyle, it divides into two main branches. Radial nerve in forearm has same the motor and the sensory functions, or it gives motor supply as well as the sensory supply. Here it divides into two main important branches, that is superficial branch and the deep branch. Here you can see this one is the radial nerve. Okay, at the lateral epicondyle of humerus, just anterior to that, it is reaches to the cubital fossa and divides into two branches. The branch you have seen that is moving posteriorly is the deep branch of the radial nerve, and which is continuous as downwards. This is the brachioradialis muscle. We have just push it back, and just below that there is a superficial branch of the radial nerve. It just which turns below the effect of the brachioradialis muscle. Now the deep branch of the radial nerve is purely motor nerve, and it is also termed as posterior interosseous nerve. The deep branch of the radial nerve is very important as it supplies the many muscles of the forearm. Okay, the radial nerve serve as the giving the motor and sensory functions in the both arm and forearm. I have told you already this. Once it divides into two branches, the deep branch of the radial nerve, after its origin, it pierces the supinator muscles or it moves backward. Here you can see this is the radial nerve, its deep branch coming backward and the superficial one going anteriorly. Okay, so this deep branch enters into the posterior part, and this is the supinator muscle which it is going to pierce. Okay, so it pierces the supinator muscles and runs in the facial plane between the superficial and deep extensor muscles. Okay, superficial and deep extensor muscles in close proximity to the posterior interosseous artery. Okay, definitely it is also termed as posterior interosseous nerves, and it supplies motor innervation to all muscles of the posterior compartment of the forearm. Okay, this was the posterior interosseous nerve, or we can say that this is the course of the radial deep terminal branch of the radial nerve in the forearm. Okay, the posterior again I'm repeating this, that this posterior interosseous nerve leaves the cubital fossa and enters the back of the forearm by passing between the two planes or two fibers of the supinator muscle. Here you can see it piercing that, and within the muscle it winds backwards around the lateral side of the radius. Okay, and it emerges from the supinator on the back of the forearm, lies between the superficial and deep muscles. At the lower border of the extensor pollicis brevis, it passes deep to the extensor pollicis longus. It then runs on the posterior surface of the interosseous membrane. As it moves on the posterior surface of interosseous membrane, it is termed as posterior interosseous nerve. Okay, the deep branch of the radial nerve supplies the extensor muscles in the posterior compartment of the forearm. Now the superficial branch of the radial nerve. The superficial branch of the radial nerve is entirely cutaneous, or it is the main continuation of the radial nerve. And this superficial branch of radial nerve gives off articular branches as well, and is distributed to the skin on the dorsum of the hand and to a number of joints in the hand. It branching soon after it emerges from the overlying brachioradialis. Here you can you can see that this is the posterior aspect of the uh, deep branch, and the one which is coming on the front side, that one is the superficial terminal branch. I have told you in the previous slide that the superficial branch of radial nerve was coming downwards, and it supplies the skin on the dorsum of the hand, and it crosses the roof of the anatomical snuff box and descending in the subcutaneous tissue of the posterior aspect of the forearm to the wrist, and also supplying the skin. So this was the cutaneous nerve supply of the radial nerve, or the superficial branch of the radial nerve. Now what happened when there is a injuries of the radial nerve in the forearm? Definitely the deep branch lies deep, so whenever there is an injury in the forearm is occurred, that is mainly because of the deep penetrating injuries. The deep part of the or deep branch of the radial nerve is not easily injured because it is lies deeply. So whenever there is a deep penetrating wounds or deep penetrating injuries or injury, then there are wounds on the posterior forearm which are deep, so that will causes the injury to the deep branch of the radial nerve. Severance of the deep branch results in inability to extend the thumb at the metacarpopharyngeal joints and other digits. Okay, the person is unable to extend the thumb at the metacarpopharyngeal joints. Why? Because the deep branch is giving its supply to that area, and you can see here this is the these are the simple digitations of the extensor digitorum. So you can see here that in the posterior compartment of forearm, the radial nerve supplying all these muscles. So the person is unable to extend these metacarpopharyngeal joints whenever there is an injury to the deep branch of the radial nerve. Definitely, there will be not complete loss because there are other nerves which are also supplying these areas. So, how we will test this? We will ask the patient to extend the metacarpal joints while we will provide resistance over here. Okay, we will provide resistance at this point, and we will tell the patient to extend the fingers. If the nerve is intact, the long extensor tendons should appear promptly here like this. Immediately, they will appear on the dorsum of the hand. Here you can see the person is going to extend the metacarpopharyngeal joints, but the resistance is providing from above surface. So there will be long extensor tendon should appear promptly on the dorsum of the hand, confirming that the extension is occurring at the metacarpopharyngeal joint rather than at the interpharyngeal joint, because the interpharyngeal joints, they are supplied by the other nerves. Okay, they are under the control of other nerves. So we came to know that the radial nerve is intact. So this was the uh, injury to the deep branch, or injury to the deep muscles of the forearm. But whenever there is a injury to the superficial branch, definitely the superficial branch will causes this sensory sensation. So loss of sensation does not occur because the deep branch of the radial nerve is entirely muscular. So if the deep nerve is involved, there will be no sensory loss. But if the superficial nerve or superficial branch of the radial nerve is involved, which is a cutaneous supply, it is severe. The sensory losses usually occur, and but it is minimum. Why minimum? Because a coin-shaped area of anesthesia occur distal to the base of first and second metacarpals. Uh, and the sensory loss is less than expected. Why? Because these areas they are also, there will be overlapping cutaneous branches of the median and ulnar nerves. So that's why the sensory loss is minimum in case of affected superficial branch of the radial nerve is affected. So when the superficial branch of radial nerve, which is a cutaneous nerve, is severe, the sensory loss is usually minimal. Okay, that's usually minimal. A coin-shaped area of anesthesia occurs distal to the bases of first and second metacarpals, which are mainly supplied by the cutaneous supply of the radial nerve. And why this is less than expected? Because it will result of overlapping of the cutaneous branches of median ulnar nerve. So here you can say at this time that we have covered the injuries in the forearm as well. Now in this lecture we have covered all of the course in relation branches of the radial nerve in arm with its injuries, along with the course relation and its branches of the radial nerve in forearm along with its injuries. Thank you so much.